Hello everyone. In this video we're going to try to cover everything that there is to know about the pathology of alpha-1 antitrypsin deficiency. So let's get started. So starting with some basic facts, the alpha-1 antitrypsin deficiency is an autosomal recessive condition. So this is characterized by very low circulating levels of alpha-1 antitrypsin, and the genes for this condition are located on the 14th chromosome. Now let's see the physiology or the normal function of this protein. So here we have the lungs, and whenever there is any kind of inflammation, the neutrophils release proteases. So these proteases destroy the bacteria or other pathogens, but at the same time, they are also responsible for the destruction of elastic fibers in the lung. These elastic fibers are responsible for the elasticity of the lung. So if these fibers are not there or they are reduced, then the lungs will lose their ability to recoil when the lung is inflated. So here is where the alpha-1 antitrypsin comes in. This protein inhibits the proteases, thereby protecting the lungs from the harmful proteases. Now let's see the pathology or what happens in alpha-1 antitrypsin deficiency. So to understand this, let's go step by step. So we have alpha-1 antitrypsin deficiency. Thus, the proteases will not be inhibited, so the amount of proteases will increase. This will lead to an increased destruction of the elastin fibers, and this will lead to a condition called emphysema. So emphysema is a condition in which the elastic recoil is decreased because the elastic fibers, which are responsible for the recoil of the lungs, are destroyed. Now these proteases are a group of proteins and are mainly of three types, out of which one you have to remember. So the main one is a neutrophil elastase, then we have cathepsin G, and last we have proteinase 3. So the first one has the elastase in its name, and it tells you elastase means breaking the elastin fibers. Now let's see the genetic side of this disease a little bit too. Now the gene for this protein, as we saw in the start, is located on the chromosome number 14. So the gene which encodes for a normal protein is called the PIMM. Now there are different isoforms that a person can get. So let's see what will happen if the person gets these isoforms. So people who have the PIMM type are normal. People who have the PIMZ type have intermediate levels of alpha-1 antitrypsin. So there will be symptoms in these people, but not that much. But unfortunately, if a person has the PIZZ variety, there will be very low levels of alpha-1 antitrypsin, even less than 10%. So till now we understood that what will happen if we don't have this protein. The lungs will lose their elasticity. Now let's see why there is a deficiency of this protein in the first place. So due to abnormal genes, there will be formation of abnormal protein. Due to this, there will be a defect in the transport of protein from the endoplasmic reticulum to the Golgi apparatus. And so the protein misfolds and it accumulates in the endoplasmic reticulum. So due to these reasons, this protein is not able to do its normal function and we have the symptoms. Now what are the pathological findings that you're going to see? So the first thing that you should know is that this protein is produced mainly in the liver. So you're going to see the cytoplasmic globular inclusions in hepatocytes which have a magenta color. So these inclusions are PAS positive and diastase resistant. And also you're going to see Mallory-Denk bodies. But you should also know that Mallory-Denk bodies are not only seen in this condition but a lot of other conditions as well. Then what are the clinical features? So apart from affecting the lungs, this disease also affects the liver. So in the lungs we saw what will happen. Now let's see what will happen to the liver. So in the neonates, there will be severe disease and rapid progression to cirrhosis. And in adults, there will be chronic hepatitis, cirrhosis, or hepatocellular carcinoma. Last part of the video, what is the treatment of this disease? So unfortunately, the definitive treatment for this disease is only the liver transplant. So that's it for this video. If you have any doubts, so please leave them in the comments and also consider following my Instagram where I upload daily MCQs. And if you have any doubts, you can reach me anytime in the Insta DMs. Thank you.